This is the House DNA Robot, or House DR for short, version 7.26. We've seen pressing here on Agree takes us to the map screen and routing template screen. Let us now focus on this field, the disclaimer. One of the purposes this was placed in for our providers is to let our providers know that there are alternative methods for billing and coding, other coding practices that include global bundling of CPT codes. If we don't know or we decline, we press here and it takes us to this screen. We believe the AMA CPT is the authoritative source for your answers and definitive answers to CPT billing and coding questions. However, we do have a commercial end to this app. Paid vendors who allow our users to come in to their websites and get some opinions about billing and coding practices. They would describe other renditions, versions, variations of the CPT code. For example, a global package may include some CPT codes and not others. So these organizations will give you their opinions on what's included and what's not included in a CPT. One CPT may be included with other CPTs, so you want to be sure to use the correct bundle or package, global package, when submitting your claims. This is not something we get into, so we defer this subject to this commercial end of our application. This takes us to the landing page. Let us scroll down and review this paragraph here. These links will be providing you with areas of practice management, practice enhancement, billing and coding organizations, private and nonprofit companies, and other entities that are in the business of giving you their opinion about what's included and not included in billing and coding. Accordingly, healthcare providers can now concentrate on rendering healthcare to patients. The administrative and billing business staff can then explore these other options of billing and coding practices by these links. Remember, a distinct function of this app is to allow providers, healthcare providers, to use in-house letters to be representative of code numbers. App works like an electronic superbill. This app allows you to replace complicated code numbers, create your own easy-to-remember customizable in-house code letters. OV is created instead of the burdensome of trying to remember if it's 99211 or 99212 or whatever. I could never remember them. Just write or type, touch, or even say OV. Spare yourself the agony of questionable changes in codes, staff leaving untimely, and waiting for staff updates, software updates, and staff to be updated. Even when changes are finally implemented, your code will always be OV, or whatever you choose representative to be your CPT in-house code. Spare yourself incrimination. Lessen your risk today. Take advantage of visiting these links that we provide for what's included or not included in the CPT. Visiting these links may help lessen and spare yourself the chances of incrimination and lessen your risk today. The benefit of this app is to allow you to use in-house letters, possibly avoid the error of selecting the wrong CPT code number.